But to talk about menopause, to make it sort of simple, to give you an idea, I mean, menopause treatment, if someone goes to their doctor and they've got symptoms of menopause, generally the mainstream approach would be, well, you don't need to test. We're happy to base this on symptoms and you can try some HRT. That might work for some people. So I'm certainly not saying that doesn't work for anyone.
Yeah.
But I'll tell you a few problems with it. Number one, what if somebody is not a full year without periods? What if they're under 50? What if they're still producing their own estrogen?
I'm Shreya Parekh and this is Empower Her, the podcast for women over 35 who want to take control of their health and wealth. Join me and my guests as we share insights, resources and ideas to help you break free, learn more about yourself and live your best life while closing the gender gaps. Hit follow to stay connected and sign up for free emails on the Empower Her website to supercharge your journey. Many are familiar with hormone replacement therapy, known as HRT, or the contraceptive pill for managing hormones during peri or postmenopause or period issues. But have you heard of BHRT? Join Dr. Anu Arasu and me as we explore alternative treatments for menopause symptoms and compare them to traditional synthetic options. Dr. Arasu is founder of London Bioidentical Hormones and is dedicated to personalised care. She studied medicine at the Royal Free and University College London, holds memberships in the Royal Colleges of General Practitioners and Physicians, and has extensive training in bioidentical hormone therapy. Tune in for an insightful discussion that could transform your health. Anu, welcome to the Empower Her podcast. It's fantastic to have you on. I'm really excited to have this conversation with you because I feel like there's not much conversation around alternative ways of looking at treatments for perimenopause or postmenopause. And I think this will be a great introduction for people out there, women out there, on what you do, because I certainly did not know anything about this until I came across you and what you do. Please, could you introduce yourself and talk a little bit about who you are and your journey from what you were doing to what you're doing now? That would be great. Thank you.
Thank you, Shreya. It's such a pleasure to be here. I'm Dr. Anu Arasu. I am the founder and medical director of London Bioidentical Hormones. And we are a women and men's health clinic. And we do personalised medicine. So we treat hormone imbalances in women and men of all ages with a personalised, individualized approach. And that's just so key because when I first started out as a doctor, I was working in general practice, I was working in hospitals, and so often I felt that the approach was very binary. It's really, you either have a disease or you don't. If you have a disease, you take this drug. If you don't, you just continue, even if that means, dysfunctions and imbalances are slowly getting worse. So I very quickly realized that wasn't going to be the full approach for me, that I was going to have to go on a deeper dive. And I went on to explore functional medicine, personalized medicine, and ended up in treating hormonal imbalances because it ends up being such a huge area for both men and for women.
Yeah, absolutely. I think hormones is something that really isn't looked at because I feel like it's quite complicated. People think it's complicated. So when it comes to hormones, they kind of stay away from that research that really, really needs to be done. And I think it's quite key for women and their bodies to be like checked out on that perspective, because hormones that go up and down at different stages of women's lives, and we just learn to accept it and carry on and deal with emotions, and it doesn't really have to be that way, as I discovered with what you're doing. Can you just, I know you mentioned functional medicine, can you just explain a little bit about what that is specifically?
Yeah, so essentially it's using a lens where we look at what normal physiology is, because at the moment in mainstream medicine we study disease. So it's starting from quite a negative place. So we study disease and we treat disease. At a bigger scale, what happens before disease? There are dysfunctions and imbalances. Where are we trying to aim to get? To health. Now that's much more complex. So if we take that paradigm and apply it to hormones, essentially hormones govern our lives. In the first half of our life, we have anabolic hormones that build us up. In the second half of our life, we can shift to a catabolic state, which breaks us down. So we can suddenly find that we are losing muscle mass. We are getting thinner bones. We are having the impacts on our heart and our brain because we are in a state of metabolism. And this is all governed by hormones. So when we start to understand the complexity of normal physiology, we start to say, well, hang on, why don't we start to do things at the level of dysfunctions and imbalances before it leads to disease? I think that's the step that's really missing. And this is where people feel very disempowered and helpless, because they can start to feel things going wrong. But when they go to their doctor, they're told, well, there's nothing wrong with you. You don't have a disease. Off you go. And people don't know what to do with that. And actually, people are very motivated. They really want to change, right? But they're not being given the information. And worse still, they're not even being told, well, actually, mainstream medicine, we just deal with disease and treatment of disease. There's a lot more to this. If you want to dig deeper, I signpost you here. At the moment, that bit of the conversation is missing. It's almost like they're being met with this paradigm of, this is it. This is the entire picture. There's nothing more. There's nothing wrong with you. Go away. And I think that's where people start to feel really, really lost.
Yeah. And also you're kind of either told to mask things with medication. Obviously some medication is absolutely essential, but when you're masking certain things with paracetamol and ibuprofen and still continuing with this disease or pain that you're having in your body for many, many years, you can't keep taking paracetamol and ibuprofen for forever. So it's really important to look at, I guess, the whole. And I guess I'm assuming that's what functional medicine is about, looking at.
Exactly. I mean, masking a symptom is the equivalent to receiving a letter and throwing it in the bin. So, in a sense, the symptom has been dealt with by taking a painkiller or something, but you haven't read the letter. You haven't actually said, well, what's my body trying to tell me? That's where the functional medicine approach and the personalized medicine approach comes in. And, this is absolutely the future of medicine. I mean, this is happening. It's happening inevitably. I mean, we see it happening most obviously in gene therapy and what's happening with genetics. So this is real. It's big. It's coming. But right now, individuals are not hearing that.
Yeah, exactly. And they don't know about it, and they're not diverted or directed to the people that alternative or different things that they can look at and different people that they can see to address the symptoms and issues that they're having with their body. With the hormone side of things, I know this is, a very, very big thing. And I'm really passionate about the hormone stuff, because I feel like with hormones, even with me, you go up and down, and you deal with it. You get on with it every single day with your symptoms. Can you talk a bit about what you do on the hormone side and what BHRT is?
Totally. Yeah. So first of all, I think in the future, we're going to even stop, making so many distinctions between mainstream and alternative. I certainly feel that what we do is very mainstream, but just a much deeper dive. To give you an example, at the moment, the framework for women and hormones is, look, you're either in menopause or you're not. If you're in menopause, you can try some hormone replacement therapy. That's an umbrella term for a whole bunch of things. Some drugs, which are synthetic hormones, a couple of bioidentical hormones, which are identical in structure to the body's own. We treat them as if they're all the same thing. You can just have some HRT if you want it. That's if you're in menopause. If you're not in menopause, we don't really think about hormone imbalances. You can try a contraceptive to regulate your periods. You can take a headache pill. That's about it.
Yeah.
So it's quite a binary approach. The reality is that, menopause is the cessation of periods. Up until that point, we have many transitions. When we first start our periods as teenagers, it takes time before we get regular ovulatory cycles. So that can be a really tough time, as we all remember. You can have irregular, heavy, painful periods. Then you can have quite a good stretch. As you hit your mid-30s, late 30s, you can find that perhaps your progesterone is starting to drop. Your periods are becoming a bit more problematic again. In your 40s, you could still not yet be perimenopausal, but have low progesterone and be getting symptoms of low progesterone and never have even heard that that's a thing, that low progesterone is a thing. Then you hit perimenopause, which is the progesterone might be low, the estrogen might be swinging all about, okay at times, dropping low, shooting high, all over the shop. Then it might be low continuously, but still not undetectable. Then you might hit menopause, whereby your ovaries are not producing significant amounts of estrogen or progesterone. So what we can see is how much of a journey it is.
Yeah.
And essentially what our clinic does is recognize that journey. So we would explain to people, that there's a journey that happens. We test the hormones. We look at things like estrogen and progesterone levels, and we just give people what they need. If they're just low on progesterone, they would just get progesterone. And we only use hormones that are identical in structure to their body's own. Whereas things like contraceptives, they're not actually identical in structure to our body's own hormones. That's why they suppress the ovaries. And that's in many cases, and that's good if you don't want to fall pregnant. That's really their best use, is as a contraceptive. They're not so ideal for treating symptoms of hormone imbalance, because they don't do what our own body's natural progesterone does. So if you're low in progesterone, and that means you can't sleep and you're anxious, if you take a synthetic progestin, which is found in a contraceptive, it won't necessarily help those symptoms.
Yeah.
And that's well known in the research. That's not its primary function. Its primary function is actually to be a contraceptive. So giving that to women who are having period problems or who are having other symptoms is not necessarily the best option. It may be the easiest, it may be the most cost effective, it may be the one that we, know the most about.
Yeah.
But it's not necessarily the best one.
So with what you offer, is that available is there an age on it, or is it something that can be offered to any girl or woman of a certain age?
Yeah, so we treat women, of 18 plus, of all ages.
Yeah.
But to talk about menopause, to make it sort of simple, to give you an idea, menopause treatment, if someone goes to their doctor and they've got symptoms of menopause, generally the mainstream approach would be, well, you don't need to test. We're happy to base this on symptoms, and you can try some HRT. That might work for some people. So I'm certainly not saying that doesn't work for anyone.
Yeah.
But I'll tell you a few problems with it. Number one, what if somebody is not a full year without periods? What if they're under 50? What if they're still producing their own estrogen? That approach, we see this all the time. That person gets given the same amount as they would if they'd been 2 years without any periods, and they're having 20 hot flushes a day and they have no estrogen. They get the same in perimenopause as they get in menopause. And what happens is it can be too much estrogen, and then they get side effects. They get constipation, headaches, etc.
Right.
But they don't know why, right? Because that whole psychology of we're checking your hormones, we recognize that this is a journey. We recognize that at this stage you need less estrogen than at this stage. That whole step is being missed. So generally someone's being given something. If it feels too much, they're just told, well, you can try an alternative or you can do nothing. But we're not really going into the depth of why it's not working for them. So that's one example, perimenopausal women and even menopausal women taking products that don't suit them. Number two, I did mention that hormone replacement therapy is an umbrella term for a number of different things. There is evidence that bioidentical hormones are preferable to their synthetic counterparts. I've written a little book about this, so people can download this from my website. I won't get too dry right now, but it's really interesting. It's a fascinating subject, and it's referenced in the guidelines. It's a thing. Bioidentical hormones are preferable to synthetic hormones, but all the products are licensed. When you go and see your doctor, they may not even make the distinction, which I know women are going to find crazy. Like, oh, if you knew that bioidentical hormones are better, Why didn't you tell me? Well, actually, the guidelines are that you can prescribe any product for menopause. Some are synthetic, a few are bioidentical. It's kind of luck of the draw. So women might feel a bit let down by that. Again, just kind of a lack of time, a lack of going into the depth, a lack of going into the subtlety. So that's one example of what will happen to women around the time of menopause. Now, if we come to pre-menopause, this is even more a bit of a shot in the dark, because essentially premenopausal women in the mainstream system just get offered contraceptives.
Yeah.
Why? Because they have hormone imbalances and any treatment would require personalisation. The mainstream system is not set up for personalisation. The mainstream system is set up for one drug for one disease, i.e. you can try this for menopause. What if you just have progesterone deficiency? It's not a diagnosis. It's not a, one set condition. It could be a big gap. It could be a little gap. It could be, you see, the greyness.
Yeah.
So in order to treat that, you need a personalised approach. So that's someone who goes to the mainstream system for for a period problem is really going to be offered a contraceptive. And often people don't get the results they want with that approach.
Yeah, absolutely. I can absolutely resonate with that, because I've been given contraceptives, and it didn't agree with me, and I just dropped the whole thing. There was nothing else I could do, and I've always felt like I've had hormonal imbalance, but I could never get tested for that. There was nothing anyone seemed to be able to do, and I just lived with it and continue to live with it. And when I came across you and what you do, I thought, what is this? Can you just tell me about how BHRT is different to the synthetic stuff? What can you talk a bit about the detail of what it is exactly?
Yeah, sure. So bioidentical hormones are identical in structure to our body's own. Synthetic hormone-like drugs are not, quite simply. And what that means is that a synthetic progestin, as well as binding to the progesterone receptor, will go and bind to other steroid receptors in the body, which means it can cause side effects like weight gain, like acne, that if it was just binding the progesterone receptor, it would not do. So that's why. Now, we've also got research, this comes from the menopausal women, that synthetic progestins have negative impacts on breast cancer, cardiovascular disease, strokes, blood clots, that bioidentical progesterone has not been shown to have. So it's big, it's important. And that's all there. So that's one difference between bioidentical hormones and synthetic hormones. The second difference is this lens that I keep coming back to, this personalised approach. So often women kind of hear a bit about hormone tests on Instagram or on a podcast, and then they go and speak to their doctor, and their doctor says, hormone tests are pointless.
Yeah.
The hormones move about all the time. There's no point doing them. And look, there's no point doing a hormone test if it's not going to change your management. So if a practitioner does a test and they have no intention of changing their management based on the result, it's not going to be very useful. So as I've said, that mainstream approach to menopause is tests are not necessary. Women over 45 do not need hormone tests, because we can just kind of assume it's either perimenopause or menopause and throw something at it. That is actually the guideline. So in that case, doing a hormone test, if that's a decision anyway, you're just going to try something, it's not going to change much. However, if you're going to a practitioner where they are open to personalised medicine, to individualising the dose, they're going to do a test. They may find that you still have lots of estrogen, that you only need progesterone. They only give you progesterone. It's going to make a huge difference. And tests are a very useful snapshot. To be clear, we do use hormone tests.
Yeah.
Even in mainstream medicine, of course, to make diagnoses of polycystic ovarian syndrome, of premature menopause. So hormone tests themselves are absolutely valid. They're mainstream. They're used. They exist. It's just the confusion happens when women hit perimenopause or menopause, or women over 45 are told, you're over 45, you don't need a test, because basically it's not going to change our management. We're just going to give you a trial,
Yeah.
HRT. But if you want a bit more of a subtle approach, then a test, even if you're only over 45, is valuable because it allows you to see what's going on and to maybe change your doses as time goes on. So those are the two differences with bioidentical versus synthetic hormones. One, the physical difference with the product that you are taking, right? And there are a few bioidentical hormones that, you know, are available on the NHS. So one is the difference between the physical product that you're taking. But number two, which I think is possibly as or even more important, is the approach with which you are being treated. You know, is your practitioner using an individualized approach? Are they considering hormone imbalances? Are they considering this as a journey and just giving you what you need?
Yeah, yeah. You're right. I mean, I think when you go to your GP, typically it is, if you're having the symptoms of menopause, it is, you know, right, you can either do nothing or we can offer you HRT. And from what I believe, HRT isn't available as a blanket to everyone. It depends. I don't know. Does it depend where you live or the area you're in, or is it open to every woman that's going through that stage?
Should absolutely be open to everyone that's going through that stage. Like, you know, I don't think it could ever be a postcode lottery. That would be awful.
Yeah.
However, there are, you know, products that go out of stock. And that's a real thing. You know, there's accessibility issues with getting appointments. There's the fact that, you know, some practitioners are more dismissive than others. So that's already one hurdle. And then the type of HRT that you get, you know, often there's not that sort of subtle discussion of, well, there are different types of HRT and this would be best. I mean,
are there different types?
Well, yeah, within that hormone replacement therapy umbrella, as we say, you know, that can include synthetic hormones or a few bioidentical ones, and if possible, bioidentical ones.
Right.
I mean, the only reason why someone may be refused HRT, you know, would be sort of medically if they had some reason not to take it. Like if they'd had, you know, a very recent breast cancer that was hormone receptor positive, that would be a reason not to take hormone replacement therapy. Otherwise, you know, benefits really outweigh the risks, and should be widely available to all women.
Yeah. I want to talk a bit about hormone testing because I feel like you said, it's dismissed quite a lot because, you know, as the saying goes, your hormones are constantly going up and down, so there's no point on really testing your hormones. Now, if that's the case, I know you say that, you know, it's really important to test your hormones. So how do you manage the fact that they are going up and down on maybe a daily or weekly basis? I don't know too much about how hormones fluctuate. And when you do the testing, is it kind of you test over a period of time, or is it one test and you can find as much information as you need from that test in order to do that more kind of bespoke, personalised prescribing, as opposed to the blanket, here you go, take this and you'll be, you know, see what happens kind of thing?
Yeah. So, as I say, I've linked the value of testing with a personalised approach. I think the two go hand in hand, right?
Yeah.
Because if you just do a test but you don't have the personalised approach, it doesn't change your management, then why spend the money on a test, you know? So the idea of testing is to basically personalise it and to learn about your body. Now, I think this is a really big thing. You know, if you're curious about learning about yourself, and it actually changes your health, and this is the whole, it's a bit like personal growth. It's a bit like doing therapy or something. You learn about yourself. There are patterns. There are very useful patterns. Everything is possible in terms of what the question that you asked. Both of them are possible. If someone has migraines, one can actually check their hormones across every day across a month and look for patterns. If someone has recurrent symptoms that always happen, you know, in the week before their period, and that's the pattern, right? You're going to do a test on that time and see what's going on. And it's going to give you an idea of, you know, what is the pattern happening. If someone has just started to find that their periods have changed, perhaps they're late 40s, the gap between their periods has changed, the heaviness has changed, they're getting a few symptoms, you do a test and you're going to get an idea. Is this the beginnings of perimenopause? Is it the middle? Are they actually very, you know, close to being done with this all. You're going to get an idea of how hard their brain is working to kick their ovaries, how much estrogen they're producing, whether they're ovulating most cycles. So it is a snapshot, but it is very useful if you take it. If you're analyzing, you're looking at the results, you've got lots of experience, and you're matching them with the person in front of you. So that's the kind of approach I would say. But I would also encourage people to almost use the personal growth model a bit when it comes to their health. Because we have to learn about our bodies and what suits our bodies.
Yeah.
I don't know if that part resonates with you, or what you would say about your own health journey in relation.
Yeah, absolutely. One thing I have really realized is that, most of the things you do when it comes to your health, and most things that you do in life is a really personal thing. What I do and what you do and how your life is and how my life is, it's very different, or it could be similar in some ways, but we are two different people. What works for you may not necessarily work for me, and that is for me a really big eye opener, because you fall prey to a lot of things that are being sold to you, like you said, whether that's on Instagram or on podcasts or anywhere, in newspapers, anything, and you do this and you will get this result. But it's not always that way, because that thing probably won't work for me because I'm different and my environment's different. So I really need to, I'm such a huge advocate for now going through this personalized, more bespoke approach to life. I think it's so important. And I've just realized that more and more now. So this is why when I came across you and what you do, it kind of instantly attracted, because now I'm looking for more personalized things. I'm looking for different ways of doing things, and things that people have never heard of. I've never heard of this before. And I think it's great to get this out there as an option for people to look at, as opposed to just going to your GP. Well, I think that should be the first point, that you should always seek advice from a medical profession. I know, like yourself.
Absolutely. And we are, and that's absolutely what, we are all doctors, and we all do that. We all
exactly
make or exclude diagnoses as a primary thing. That's absolutely right. So this is, and to come back to that point, what we're saying is mainstream medicine, fantastic for identifying disease and treating it. The stage before you get disease, the dysfunctions and imbalances. Let's say the pre-diabetes picture, right? Yeah. What do you do about that? What do you really do? How detailed do you go? How do you make the change? And there will be some patterns that are true for all of us. It might be the case that all of us, as we hit 40s plus, find it harder to shift weight, don't metabolize carbohydrates as effectively as we did when we were 18 years old, put on more weight centrally, which is the worst type of fat, because it's a visceral fat and it sends out signals to the rest of the body. There may be certain things that are true for all of us. Within that, there's then going to be subtleties and things that can be fine-tuned. Reasons why, if two people are exposed to the same problem, one of them ends up really suffering and the other one is comparatively fine. That's really what this whole personalized medicine approach is about.
And are there any side effects with the way you approach things and the way how you kind of, with the testing and the actual BHRT?
Yeah, I mean, look, if you take too much of a hormone, that could cause side effects. So, and that's where the follow-up, the support, the communication is important, because it's that feeling, I'm a bit constipated. Could this be the estrogen that I'm on? Could it be the dose is too much for me? So, but I think the personalized approach really avoids side effects, because that's the point. By testing and just giving people what they need and having that good communication, we avoid a lot of the problems that one runs into if one tries to just kind of make a presumption and try some HRT. That's exactly the difference.
Yeah, I guess it's a bit like taking a multivitamin. You know, you're taking a multivitamin, but you probably don't need all those vitamins. You might just need the iron or the, you know, vitamin D, but yet you're taking the whole multivitamin, and it's just pointless. That's the way I'm looking at it. I don't know.
Yeah. I mean, yeah, that's a whole nother that's a whole nother rabbit hole discussion, isn't it?
Oh yeah. No, as in
You're right. I mean, I think the point. I mean, you're absolutely right. Which is, I think, what you're trying to get at is sledgehammer approach. You know, that are we at risk if we just say, look, you're probably in menopause, you're in perimenopause, menopause, try some HRT. Are we at risk of using a sledgehammer? And you know what people would from the experiences of patients, I would argue, yes, that is a risk. You know, some people might be fine, but there are many people that just feel, no, that dose wasn't right for me, and you know, I've put on weight, and you know, because of that thing that I was taking, and that's just not acceptable to me. So I think that's for sure a part of it. And the second part is just the power of learning, the power of gaining that body awareness. So really understanding how many facets there are to our health. I think it's such a, you know, I think when people start on this, the main feedback we get is, wow, you know, it's changed my life. I see things differently. You know, I'm now doing X, Y, Z. People really learn about their bodies, like a, you know, it's like a Ferrari in a way. We all get given this amazing car. We don't have a clue about how to drive it.
Yeah.
And there's a lot in it. There's a lot in it, actually. You know, in terms of our genetics, how we detoxify things, our gut, our microbiome, you know, our hormones, all of this stuff.
Yeah, that's a whole different discussion, the gut and the microbiome.
Yeah.
So, look, if we wanted to know more about what you do and how you do it, where can we go to? Because, you know, if I wanted to consider it as an option, where's my starting point?
Yeah, our website, which is www.londonbioidenticalhormones.com. I hope you put a link somewhere so that
I will.
I just spell that. But and essentially on the website there are a few things. First of all, you can just read a lot. There's quite a lot maybe to read on there. There are some downloads, a guide that explains our overall thinking, the roadmap, which I think is quite helpful for people. There's my free ebook, which is specifically about the difference between synthetic hormones and bioidentical hormones, the research that shows the difference between those. And then you can always book a discovery call to find out about, you know, what it means for you, if we would be the right partners for you. Yeah.
That's great. I think, that's a great starting point, actually, that you actually have this free ebook that people can go to really understand what you do and what it actually is, and then make that decision whether they want to go down more of a personalised route and discover what you do in more detail. I think that's perfect. So, of course, all the details are going to be in the show notes and through the social media channels. But I think this has been a really super useful discussion, because I don't know out of my friendship circle and the people I know, I don't think they know about this. And definitely people should be looking to it to find out more and discover an alternative way, perhaps, for them that they can go to. And if they still decide to go through, you know, the traditional route, the HRT or other ways, there are plenty of other things people can do as well. Then that's fine. But ultimately, you know, you should be empowered to make the right choice for you.
That's the take-home message from my perspective. I think I would love people not to feel that there's such a big gap between what they hear about or they read about and then them actually getting in front of their doctor and their doctor saying that's a load of rubbish, that doesn't exist. I would love people to kind of just the whole spectrum to be sort of explained, you know, that on the one end we have the paradigm of, you know, diagnosing a disease and treating that, but that before we reach the point of disease, there maybe things that we can feel in our body we are not doing as well as we could be doing on, and that we're not feeling as great as we could be. And what do we do when we're in that messy middle? That's really, for me, what I would love people to feel empowered about.
Yeah, absolutely. Anu, thank you so much for being on the Empower Her podcast. It's been great to have you on.
Thank you.
Thanks for tuning in to Empower Her. I hope today's episode has left you feeling inspired and motivated to make a positive difference in your world. Please follow the podcast and share it with anyone who will find it helpful. Until next time, keep striving for positive change and greatness for all women.